मैंने एनेट एकेड ग्रुप पे एक इमेज डाला है जिसमें मैंने, आप देख सकते हो कि कितने पैसे मैं कमाता हूँ इंस्टाग्राम से। देखो ना, देखो देखो, पहले देखो। उसमें लिखा है कि यू हैव टू अर्न मिनिमम $25 टू गेट एनीथिंग। सो बेसिकली I don't earn anything from all these videos which I make. I don't make it for money also. I make these videos not for getting some million views, which I do it for you people. You 150, I am posted here. It's my duty to teach you and so that you can revise. I'm so happy. One thing really makes me happy कि you people really were following, excited and happy कि मिला कुछ views. But what I really want is कि आपको उसका benefit हो, मुझे उसका benefit कुछ नहीं चाहिए. You go to YouTube and type any organ you have to study. Liver by Dr. YJB. If you are subscribed to my channel, 4-5 options will come. And one of the options will be COVID time option, which I have taught on paper. That is one of the best. So anything you want to study, medium now by Dr. YJB, 5-6 videos आएंगे. You can उसमें से now with this batch medium now revision in 3 minutes भी मैंने डाला है, so that one day before the exam you can revise the topic. So use it for your benefit. ये आप 150 लोगों के लिए है, बाकी others who are following it, I'm thankful to them also, and not thankful, they should be, if they are benefited, I'm happy. Okay, thank you. तो चालू करते हैं. So yesterday we have studied the pancreas. Yesterday means last class. We have studied the pancreas, and we studied that pancreas has a head, body, right, and a head, neck, body, tail. Yeah, and uncinate process. Now let's talk about the development of the pancreas. The pancreas. The pancreas developed from, if you take a cut section of the gut, from ventral pancreatic bud and dorsal pancreatic bud. Ventral and dorsal pancreatic bud, which develop from almost near the junction of foregut and midgut. Now with the rotation of the gut, what happens is, the ventral bud, this is the dorsal bud, and ventral bud comes to lie below. So this is now the dorsal bud, dorsal pancreatic bud. This is the ventral pancreatic bud. Okay, it comes to lie below the dorsal bud, which was ventral. Due to rotation, it has come below. Now this is the duct. This is the duct of each of those buds. Now what happens is, they join here like this. Main pancreatic duct develops from here, which opens on major duodenal papilla. Accessory pancreatic duct opens on the minor duodenal papilla. Okay? Now, if I am asked development of pancreas, I say pancreas develops from ventral and dorsal pancreatic bud. What develops from dorsal bud? 1. Upper part of head. 2. Body. Neck. 3. Body. 4. Tail. Then distal part of main pancreatic duct. Distal part of main pancreatic duct and accessory pancreatic duct. Accessory pancreatic duct. What develops from the ventral pancreatic bud is lower part of head, then uncinate process, then terminal part of main pancreatic duct. main pancreatic duct. So that is the development of the pancreas. I'll repeat again, it develops from ventral and dorsal pancreatic bud. When the rotation of gut happens, ventral comes to lie below the dorsal. This is the duct of the dorsal, this is the duct of the ventral. They join with each other. Parts developing from the ventral pancreatic bud are upper part of head, neck, body and tail. Distal part of the main pancreatic duct and accessory pancreatic duct which opens on minor duodenal papilla. Parts developing from ventral bud are lower part of head and uncinate process and terminal portion or the proximal portion of the main pancreatic duct. Thank you. Okay. Is this clear to you? And anybody wants me to repeat this? Development of pancreas. Clear? एप्रन किधर है? रजान, देन लाल टी शर्ट, नुमेरा, हाँ? हे त्याच्या पाठीमागे होतं कारण this portion is the portion from where duodenum is going to develop. Okay, so this has already gone retroperitoneal and pancreatic bud.
Does that develop in the mesogastrium or?
No, it doesn't develop in mesogastrium. This develops behind the peritoneum.
Correct, then mesogastrium testines are attachment footprint. What is the difference then? कारण how I imagine it is originally gut tubes सरळ आहेत तर ventrally dorsally दोन्ही mesogastrium entire length मध्ये असतात आणि then it starts twisting.
Embryonic life मध्ये initially तसं असतं, then it twists. In that whole process some organs go behind the peritoneum. Okay, and the organs which go behind the peritoneum is duodenum. And this is at the junction of duodenum, stomach and duodenum that is happening. So this whole thing is happening retroperitoneally. But yeah, developmentally it may be happening that time in relation to peritoneum, but eventually it goes behind the peritoneum. Yeah. Okay? This is clear? Development of pancreas. If somebody asks you about development of the stomach, we all know the stomach is initially like this, where the lesser curvature is actually anterior and greater curvature is posterior. Actually, it has anterior border, posterior border and two surfaces and connected to ventral and dorsal mesogastrium and during development, and then it becomes like this. When it becomes like this, the anterior border becomes lesser curvature, posterior border becomes greater curvature. Posterior border grows at a faster speed and therefore it hangs down. Development of the foregut. What develops from foregut? If somebody asks. Esophagus, stomach, duodenum up to major duodenal papilla. Respiratory system.
Yes.
Respiratory system, and in its upper part there are pharyngeal arches, of course, but you don't say that pharyngeal arches develop from foregut, but yes, upper part there are pharyngeal arches. Then the liver. The hepatic bud arises from the foregut. Now what is happening? See, this is the foregut This is the foregut. This ventral bud, dorsal bud are down, but from here arises hepatic bud. Hepatic bud, which goes to the septum transversum. This is septum transversum, ST, and this is hepatic bud. This is foregut. ते चालू करून ठेव. तू पडलं तरी चालेल, माझ्यासाठी तुझा अभ्यास जास्त महत्त्वाचा. So this is the foregut, this is the hepatic bud, this is the septum transversum. We are talking about development of the liver. This hepatic bud, now as it is approaching the septum transversum, this is the foregut, this is the hepatic bud. It divides into two parts, the hepatic bud proper and cystic bud. This is cystic bud, this is hepatic bud, this is septum transversum. From the cystic bud develops gallbladder. Okay? Now hepatic bud goes inside and then divides, and then divides, and then divides, and then divides. Okay? From this portion of the hepatic bud develops the bile duct. Okay? This is septum transversum. Hepatic bud goes inside the septum transversum and divides and divides. There are vitelline and umbilical veins there inside the septum transversum. So if somebody wants me to summarize the development of the liver, I would say liver develops from three sources. One, septum transversum, which contributes to the Glissen's capsule, okay, and the fibrous network of the liver. Two, hepatic bud, which forms the hepatocytes. So all the hepatocytes are developed from hepatic buds. Three, these hepatocytes then get lined by sinusoids, of course. The broken umbilical and vitelline veins contribute to formation of hepatic sinusoids. And four, the mesodermal cell, the mesenchymal cells, they go there and they form which cells in the liver? Starting from K, Kupffer cells. So Kupffer cells are developed they come from the mesoderm. Okay, thank you. So development of liver is clear? Okay. असू दे, पडला चालेल, काय हरकत नाही. तेवढं बदलायची वेळ आली तर. माझ्याकडे चांगला वाला घेऊन येतो. दिस लिव्हर इज डन नाउ. Gallbladder is also done. Pancreas development is also done. Now we go to midgut. We go to development of midgut. Step 1, all of you know that the yolk sac is pulled inside, and then the yolk sac just remains like this. All of you are aware of this, right? And then this part forms the foregut, this part forms the hindgut, and this part from the midgut, and midgut is connected to the now yolk sac, which has just reduced in size by vitalo-intestinal duct. Now we are concentrating on the midgut loop. Midgut loop. As this folding of embryo happens, the midgut loop becomes like this. Now here, what I am trying to draw is the midgut loop. In the second diagram, what I am trying to draw is the midgut loop, which is like this. This, I am going to repeat this again for all of you. Just try to understand this. This is the superior mesenteric artery. This is the midgut loop. Because of the superior mesenteric artery, the midgut loop gets divided into two parts. Pre-arterial segment, my middle finger, post-arterial segment. Okay? लिहिलं तरी चालेल तुम्ही, असं काही नाही. Pre-arterial segment and post-arterial segment. The midgut loop will continue ahead and stay connected with yolk sac. बरोबर? Stay connected with yolk sac. Now, what is the problem? That liver is huge in size in embryonic life because it is producing blood. It is producing blood cells that time. Now the intestines have to develop, but they don't have space. They don't have space. So what happens is, now I'm just calling this as pre-arterial and this as post-arterial segment. The rotation of the gut happens anti-clockwise. 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 So when I say look here, that time you have to look here. Now the first rotation that happens is 90 degree. 90 degree. Where the pre-arterial segments comes to lie on the right side, post-arterial comes on the left side. Now I am drawing them properly. Pre-arterial and post-arterial segment. And in between is which artery? Superior mesenteric artery. But gadbad ho gaya na. Now I need to tell you what all develop from pre-arterial segment. From pre-arterial segment develops jejunum, ileum. Okay? Jejunum, ileum. Now here is our vital intestinal duct. Vital intestinal duct. Okay? Terminal ileum is here. Terminal ileum. Terminal ileum is here. Then here is cecum. Then ascending column. Then the right 2/3 of transverse column. Right 2/3 of transverse column. So post arterial segment से क्या डेवलप होता है? Terminal part of ileum. Terminal part of ileum. Then cecum. Cecum. Cecum का साथ कौन आता है? Appendix. Cecum. Then appendix. Then ascending colon and right 2/3 of transverse colon. ओके, यहाँ पे हम लोग अभी थोड़ा सा पॉज लेते हैं. तो वीडियो तो मोबाईल घेऊन तो इथंच ये आता तो. हाँ ये लिखने का नहीं है, ये मैं ब्रेक दे रहा हूँ आपको थोड़ा सा. चालू करो. So appendix is there in your body. Any function it does? Huh? So people talk about system, but people, some of you may have undergone appendectomy also. कुछ आपको तकलीफ परेशानी कुछ? Then why God created appendix? He created it for the surgeons. The surgeons are also God's children, and उनका भी घर चलना चाहिए. So God had created only arrangement so that surgeons का घर चले. उनका भी आता है ना घर का हफ्ता, बच्चों का एजुकेशन, स्कूल कितना सब महंगा है. But then man, after that surgical branches divided, cardiac surgery, orthopedic surgery, पहले एक ही सर्जरी था. Then man created multiple things by all other surgeons also, उनका भी घर चले. जैसे man created वड़ा पाव, इससे कार्डियक सर्जन का घर चलता है. तो लोग वड़ा पाव खाते देन इवेंचुअली, तो जब तक वड़ा पाव रहेगा कार्डियक सर्जन तेरा नाम रहेगा. देन मैन क्रिएटेड मोटरसाइकिल, उससे ऑर्थोपेडिक सर्जन. अब भी नहीं आ रहा था तो रिलायंस मॉल के सामने ठाक करके आदमी वो गाड़ी ने ठोका, बाइक पे से वो गिरा. So orthopedic surgeon. How man has only created so that other surgeons का घर चले. Earbuds हम नहीं बनाए, इधर लगा के सुनते हैं. It's like putting a loudspeaker in your ear. उससे ENT सर्जन का घर चलता है. मोबाइल्स हम नहीं बनाए, दिन रात सुबह उठते से रात को सोने तक, उससे ऑप्थेल्मिक सर्जन्स का घर चलता है. अल्कोहल, उससे हिपैटोबिलियरी सर्जन, जीआई सर्जन्स, उनका घर चलता है. उसी अल्कोहल से यूरोलॉजिस्ट का घर चलता है. सो ऑल अदर सर्जिकल ब्रांचेस, यू नो, they are working because of our man-made things. But originally, God had made arrangement only for, because previously there was only one branch for the general surgeons. And what was that organ? Appendix. बस हर 2-3 दिन में किसी का अपेंडिक्स सर्जन के पास जाओ, गाड़ी का हफ्ता निकल गया. ओके, थैंक यू. सो अपेंडिक्स, इट इज ऑल्सो कॉल्ड एज एब्डोमिनल टॉन्सिल. ये आपको हिस्टो के वाइवा में पूछेंगे, हिस्टो के वाइवा में पूछेंगे. इट इज ऑल्सो कॉल्ड एज एब्डोमिनल टॉन्सिल. Lot of lymphoid tissue is there. Okay. हाँ, so ये अभी देखो गड़बड़ क्या हो गया. देखो ये ऐसा टर्न हो गया, तो जेजुनम इधर गया. जेजुनम ओरिजिनली इज ऑन द लेफ्ट साइड. असेंडिंग कोलन कहाँ पे गया? लेफ्ट में गया, बट होना चाहिए कहाँ पे? राइट साइड में. Okay, so now therefore a further 180-degree rotation has to take place. First the rotation was 90. First rotation was 90. Now further 180. Where jejunum from here comes here. Ascending colon cecum. Narvekar इकडे बघा. Ascending colon cecum which are here. From here they go to right side. बरोबर? When they go from here to here, the cecum actually comes to lie below the liver and slowly it descends down. Okay? So sometimes it may not descend, and liver and cecum and appendix may be below the liver. A patient may get appendicitis, he may come with pain here. So that time you need to understand that no, you know, we also, like those people who are absent today, may not they miss this diagnosis. अरे पेशेंट इधर है तो गॉल ब्लैडर भी निकाल दिया उसका बेचारे का, बट यहाँ पे तो अपेंडिक्स, अनडिसेंडेड सीकम एंड अपेंडिक्स. ओके, सो नाउ व्हाट हैपेंस नेक्स्ट? उसके पहले समथिंग हैपेंस दैट दिस जेजुनम इलियम जो है वो बहुत ग्रो करता है. and therefore it herniates outside. आपने वो देखा भी रहेगा pictures. It herniates outside into the umbilicus, comes out like this. because जगह ही नहीं है. जैसे जैसे liver shrink होता जाता है, it comes in. While coming it undergoes 180 degree rotation. Okay, 180 degree rotation, and the post arterial segment, it also undergoes another 180 degree rotation. So total, so the next what happens is that this jejunum ileum now comes to this side, okay, on this side, and the cecum, appendix, they come to lie on this side. So this was 90 degree, and then a further 180 degree rotation happens. So total rotation that happens is 270 degree. This is called as rotation of gut. Rotation of gut. जर लिहून झालं की सांगा. I'm going to explain it again to you, and then you write. So we are talking about rotation of gut, which is very difficult. लोगों के दिमाग घूम जाते हैं लेकिन rotation of gut नहीं समझते. So this is the yolk sac getting absorbed as foregut, midgut, hindgut. Midgut being still connected with yolk sac by vitellointestinal duct. Now what I am showing you is the midgut loop, and this finger is superior mesenteric artery. So the midgut loop is divided into pre-arterial segment from which jejunum and ileum develops, and post-arterial segment from, so my lower finger is post-arterial segment from which terminal ileum, cecum, appendix, ascending colon and right two-third of transverse colon develop. If you want to remember the rotation of gut, all of you, come on, do like this, okay? So the first rotation that happens is 90 degree. 90 degree. When 90 degree happens, the pre-arterial segment comes to lie on the right side, post-arterial on the left side. But I said jejunum develops from pre-arterial and cecum appendix develop from post. And now what has happened is this has come to the left side, but actually this should come to right. So first 90 degree happens, jejunum is on the right, cecum appendix is on the left. So therefore, the further 270 degree happens. From jejunum from behind comes to lie on the left side, and cecum appendix from anterior aspect, from the ventral aspect, they go and lie, take position on the right side. So the rotation of gut, first 90, pre-arterial segment, post-arterial segment, this is the midgut loop. First 90 degree, where pre-arterial segment comes to lie on the right side, post-arterial on the left side. But pre-arterial से develop होता है jejunum, this has to go to the left. Post-arterial से develop होता है transverse colon, ascending colon, which has to go to the right. So therefore, further 270. Okay, so again I will show 90 and 270 and 180. Sorry, so then for total rotation is 90 plus 180, that is 270 degrees. Thank you. This vital intestinal duct sometimes persists, and that is called as Meckel's diverticulum. Present in 2% of the cases from the 2 feet from the ileocecal junction. Okay, but अभी मैं सबने बराबर से किया नहीं, कोई ऐसे कर रहा था. चलो एवरीबॉडी, आपका हैंड ऐसा होना चाहिए आगे, पहले तो एल्बो आगे होना चाहिए और दोनों फिंगर ऐसे आपकी तरफ फेसिंग. थोड़ा वीडियो चालू करून ठेवून देतो. उबेद सर आप कॅमेरा ले लो. चालू बंद बंद कर. बंद चालू नाही ना केलं? हां
केलेलं.
असं इकडे तो बीच बीच में इनवे मेरा इज्जत का फालूदा मत करो. वापस 1 बिलियन व्यूज आएगा सब आप गलत सलत कर. चालू करने से पहले 3 2 1 बोल. पहले सब लोग ऐसे करो. हाँ चलो. हाँ 3 परत चालू कर. So now we are showing the midgut loop. This is the midgut loop. This is the pre-arterial segment, post-arterial segment, and this is the superior mesenteric artery. बरोबर करतायत का सगळे? Just check. Put on them. Everybody, come on. What is the upper finger? Pre-arterial segment. What is the lower finger? Post-arterial segment. Now we will show the first rotation. First rotation happens at 90 degree. Pre-arterial segment comes to the right side. So you can show it like this also. You can show it like this also. Pre-arterial comes on the right, post on the left. Pre-arterial से डेवलप होता है जेजुनम इलियम, post-arterial से डेवलप होता है terminal ileum, cecum, appendix, ascending colon, right to third. So everybody like this. ये तो एकदम easy है करने को. What is this finger? Pre-arterial. It has come to the right side, but it should be on the left. This is post-arterial. Ideally, it should go to the right side. And therefore, for this, the further 180. So everybody show like this. Everybody. Pre-arterial, pre-arterial, post-arterial. बीच में क्या है? Superior mesenteric artery. Very good. Come here. So now we are doing the further 180 degree. Further 180 degree. So what is happening? Jejunum is now coming to the left side, and ascending colon is going, cecum ascending colon is going to the right side. So first 90, then further 180. So they take their positions. So while that further 180 is happening, jejunum, ileum, they come from behind the artery, and cecum ascending colon, they go in the front of the artery and take position on the right side. So 90 plus 180 is 270 degree anti-clockwise. Most important word. This is happening anti-clockwise. Clock moves like this. This is happening anti-clockwise. Thank you. Exam में पूछते सर. अरे बहुत लोगों के लोग सर फोड़ते हैं वो रोटेशन ऑफ गट के लिए. वो जो हमारा वीडियो इतना सब वायरल हो गया ना, उसके नीचे 4-5 लोगों ने लिखा था अगर दम है तो रोटेशन ऑफ गट सिखा के दिखाओ करके. It is really difficult to understand. बोला. नाही ती तशीच राहते. हां ती मेसेंट्री मध्ये असते. आता डॉर्सल मेसोगॅस्ट्रियम आता गेलं. मेसोगॅस्ट्रियम गेलं. इट इज इन द रूट ऑफ द मेसेंट्री. हां आर्टरी तशीच राहते. हे फक्त असं येतं पाठीमाग. मग त्याचं काय होतं ना की जो इनिशियल पार्ट जो पाठीमागे जातो ना आर्टरीच्या, दॅट ॲक्च्युली फॉर्म्स द डिओडिनम. आणि मग हे जे पुढे येऊन पुढे असं डेव्हलप होतं, दॅट फॉर्म्स द जेजुनम. And then ileum already terminal part इकडे तो खाली डिसेंड होतो. Got it? So that brings us to actual today's topic. That is jejunum and ileum. तर फटका दे को पाठीला. तपली मार. इतके आहे. Use of sternocleidomastoid is prohibited. Turning the face to the तुमच्यासाठी. Now this is a very short topic. उसमें आपका ज़्यादा टाइम नहीं जाएगा. One is difference. One is small intestine. One is large intestine. And third topic 5-5 मिनट का टॉपिक है. नेक्स्ट लेक्चर किसका है अपन उसके ऊपर डिसाइड. हमारे and then difference between jejunum and ileum and difference between small intestine and large. पहले क्या चाहिए आपको? Small and large. Small and large. ये चार्ट आपके बुक में है. तो फिर मैं क्यों सिखा रहा हूँ? मैं इसके लिए सिखा रहा हूँ, खाली आप याद रखो कि कैसे याद करना है उसको, कैसे याद करना है। Small intestine and large intestine. When I teach this, I say there are 4 features of large intestine which are absent in small intestine. आपला हा मोबाईल लावून ठेव आणि मग तो लिहिलास तरी चालेल. So difference between small intestine and large intestine, I am telling you an easy way how to remember. There are 4 features of large intestine which are absent in small intestine. One is presence of appendices epiploicae, which are fat-filled pockets. You must have seen in the dissection, appendices epiploicae, which are absent here. Then, presence of tinea coli. Tinea coli, that is the longitudinal muscle getting arranged in 3 layers, in 3 parts, which is not there in small intestine. Because the tinea coli is shorter than the actual length of, actual length of large intestine is this much, length of tinea coli is this much. उसके ऊपर जब large intestine डालते हैं तो सैक्युलेशंस फॉर्म होते हैं. जैसे लड़के आप लोग कभी गलती से पायजामा पहनते हैं शादी विधि के टाइम, पायजामा इज दिस मच but girth is this much. So when you put the nadi, then there are saculations which develop. So next time you can look here for saculations. So saculations. 4th is distensibility. Large intestine is quite distensible compared to small intestine. So 4 things which large intestine has, small intestine doesn't have. Now 4 things which small intestine has and large intestine doesn't have. One is pairs villi. Villi are not seen here. 2, circular mucosal folds, which are permanent. Circular mucosal folds, which are not there. Which are permanent here, they may be temporarily present in large, but not permanent. Okay. 3, mobility. Mobility. Large intestine, except for the transverse colon, sigmoid colon, thoda part, most of the part is fixed. Ascending colon, descending colon. And 4 is pairs patches. Pairs patches which are absent here. Okay. So this is the easiest way to remember difference between small intestine and large intestine. 4 things present in large intestine: appendices epiploicae, tinea coli, saculations, and distensibility, which is absent in small intestine. 4 things which are present in small intestine which are absent here are villi, circular mucosal folds, mobility, and pairs patches. Thank you. 3 मिनिटापेक्षा कमी होत आहे सहसा.
आता होता तो 2 minutes 51 चा होता.
ओके. ठेव. ह्याला आपण आता लास्टलाच घेऊ. जेजुनम एंड इलियम. जेजुनम इलियम में क्या अभी हम लोग ज़्यादा ही डिटेल्स में जा रहे हैं. आज परत जनता ॲब्सेंट युधिष्ठिर है. तेरा 92% अटेंडेंस है, सब तू क्लेम करता. जस्ट फॉर योर इंफॉर्मेशन कि अटेंडेंस अगर कम है 60% से, तो नया बैच आ रहा है 2026, उनके साथ ही बैठना पड़ता है. स्कोप नहीं है अपने को. आज काजी सर आ गए, बंद करना पड़ेगा. जेजुनम इलियम में क्या डिफरेंस है? हाँ काय प्रोनाउंस स्पेलिंग
the other gland.
Huh?
Pairs patches are present in.
Okay. So one is firstly on the left side, left and upper, right and lower. The villi are leaf shaped. Villi are leaf shaped. Villi are finger shaped. Leaf shaped, finger shaped. Okay? क्या तू बुक नहीं खोलते कोणी कार्ड उघडलंय पुस्तक तू अभी तू खोलेगा फिर देखील तर ते चार्ट आहे का तुझ्यासमोर वॉल थिकर असं लिहिलंय बघ वॉल थिकर जेजुनमला लिहिलंय ना वॉल इज थिक आणि ह्याची वॉल इज थिन लुमेन लार्जर पण ह्याला लिहिलंय ना बरोबर ना बाळा so this lumen is small. Then solitary lymphatic patches are present at both the places, but pairs patches are absent here. Pairs patches are absent here. Pairs patches are present. Now there is one thing, and that is the structure of the mesentery. Now this is the mesentery. Mesentery में there are arterial arcades. Arterial arcades. And from these arterial arcades, vessels they go to the small intestine. So this is the arcade. This is the arterial arcade. तो हमारी सुपीरियर मेसेंट्रिक आर्टरी है ना उधर सुपीरियर मेसेंट्रिक आर्टरी उसमें से ये आर्टरी जाके आर्केड बनाते गावाकडे मुंबईच्या बाहेरची लोक कोण आहेत हात उभरती करा गावाकडे आपल्या आर्केड असते की नाही गोविंद आर्केड तुमच्या गावात आहे काय का आजूबाजूला कोई नहीं है आपने देखा है आर्केड आपके इधर कांदुली बोरीवली हाँ सुलेमान आर्केड सफवान आर्केड असं दे आर्केड मीन्स अ मल्टी स्टोरीड थिंग इसके लिए बिल्डिंग्स आता है ना आपके सोसाइटी में वगैरह सोसाइटी में आपके एरिया में वगैरह कहीं देखा नहीं आपने सडनली कॉम्प्लेक्स आ जाता है ज़्यादा एकदम बड़ा नहीं उसको आर्केड बोलते हैं मल्टी स्टोरीड कॉम्प्लेक्स इज आर्केड हियर द आर्केड is only 1 to 2 storied बरोबर का 1 to 2 here it is 3 to 6 1 2 3 यहाँ पे at the end of the arcade there is a vessel which goes to the jejunum that is called as vasa recta this is ileum so vasa recta are longer and fewer vasa recta are longer अरे लोगों को समझता नहीं है इसके लिए मैं ड्रॉ करके बताऊँ वाजा रेक्टा और लॉन्गर बिकॉज आर्केड्स ही थोड़े हैं 2 ही स्टोरेड के आर्केड है यहाँ से सुपीरियर मेसेंट्रिक आर्टरी ब्रांचेस देगी 2 आर्केड फॉर्म करते हैं फिर वाजा रेक्टा और लॉन्गर एंड फ्यूअर ये 5-6 मजले स्टोरीड आर्केड्स हैं, तो इसके लिए उसके वाजा रेक्टा आर शॉर्टर एंड मेनी. Anybody who has not understood, I can repeat again. वाजा रेक्टा 3 to 6 and मेसेंट्री मध्ये हे मेसेंट्रीचे डिफरन्सेस आहेत. आर्टरियल आर्केड्स 1 to 3, arterial arcades 3 to 6, vasa recta longer and vasa recta fewer. Vasa recta are short and many. आणि मुली फॅट इज अबंडंट. कुठे गेली ती मुलगी? ती खाली बघते, तर मी तुला विचारतो, फॅट इज अबंडंट तिकडे आहे ना? फॅट इज अबंडंट, फॅट इज अबंडंट. अजून चौथा एक पॉइंट आहे का ग? फॅट इज अबंडंट and here fat is less. Okay, in the mesentery म्हणजे you have seen the mesentery yesterday. Krishna, you have seen the mesentery. Okay, फॅट अबंडंट तिकडे. मी तुला बोलत होतो, तर तू पुस्तक समोर आहे म्हणून मी आय वॉज टेलिंग यू दिस. फॅट इज अबंडंट. हाउ आई रिमेंबर दिस फैट इज अबंडंट? बिकॉज मेजर एब्सॉर्प्शन यहाँ पे हो जाता है, तो मैं ऐसे सोचता हूँ कि उधर फैट अबंडंट है इलियम के मेसेंटर. ओके, स्टार्ट. So we are discussing differences between jejunum and ileum. Jejunum is more on the left side, and upper part. Ileum is right and lower part. Villi in jejunum are leaf shaped. Villi in ileum are finger shaped. Wall of jejunum is thicker. Here it is thinner. Lumen is large and empty most of the time. You have to write this, large and empty. Here lumen is small and full most of the time, because jejunum empties faster. Ileum में food stays long. Pairs patches are absent in jejunum, they are present in ileum. Now the next points are about the mesentery. The mesentery goes like this: encloses jejunum, encloses ileum. From the inside the mesentery, superior mesenteric artery which gives branches. Each branch divides to form arcades. Arcades are just 1 to 2. Okay, 1 to 2 in case of jejunum. Therefore, the vasa recta, we start from the arcade to jejunum, are fewer and longer. Arterial arcades in ileum are 3 to 6 storied, and it almost reaches up to ileum. Therefore, the vasa recta are shorter and fewer. There are many, shorter and many. Fat in the mesentery is abundant. Mesentery is abundant in case of ileum, and it is less in case of jejunum. The last चा point है, आणि तो आहे appendix. स्मॉल इंटेस्टाइन हमारा कितना लंबा रहता है? हाउ मेनी फीट?
20.
हाउ मेनी फीट?
Approximately 20.
हाँ?
20. 20 feet है 6 meters. 6 meters
हाँ?
2 meters. 6 feet. 6 feet.
हाँ? नहीं एवढं. हाँ? 6. हाँ? 6 मीटर. हाँ, 6 मीटर. मी फीट मध्ये विचारलं. आय एम सो सॉरी.
6 meter 20 feet. 6 meter 20 feet.
6 meter or 20 feet. Now what I want to impress upon all of you is, ते चालू कर रहे. हा खूप महत्त्वाचा पॉइंट आहे. If you see the length of our small intestine, which is in meters, more than 5 meters, 6 meters. मीटर मतलब आप देखते ना कि सो इतना लंबा अगर हमारा मीटर्स में अगर हमारा स्मॉल इंटेस्टाइन है, so we need to have lots and lots and lots of fiber. It is very much necessary. Okay, we cannot just have other foods which don't have fibers. So always, इसके लिए आप कोई भी डाइटिशियन के पास कभी भी जाओगे तो वो सबसे पहले बोलते हैं फाइबर बढ़ाओ, ककड़ी खाओ, गाजर खाओ, बीटरूट खाओ. So please, for that passage to happen, for food to pass through all of this, importance of fiber is there, because intestine is in meters, and after that comes the long intestine. The ascending colon is 5 inch long. The transverse colon, is 20. Descending colon is 10 inch. Sigmoid colon is 15 inch. Rectum is 5 inch. So this is also a huge passage. And therefore again the importance of fiber. Now here is cecum. Cecum is the organ where breadth is more than the length. Very few organs where the breadth is छोटा सा ही है, but उसका breadth is longer than the length. Then this ileocecal junction, it is one of the shortest diameter which is there, and therefore the intestinal obstruction होता है ना. आप सोचते हैं चीकू खाते समय मोबाइल में नहीं देखने का, क्योंकि वो बहुत बड़ा रहता है उसका भी, और वो गया अंदर गया तो स्टमक में से शायद आगे जाएगा. मैडम को बोलो अंदर जाएगा, बट देन इट विल गेट स्टक इन. इधर से आगे नहीं जाता, इसके लिए ऑपरेट करना पड़ता. ओके, so this is the shortest area apart from cupricopharyngeal sphincter, pyloric sphincter. ये कुछ areas हैं. And last is the appendix. बंद करो, चालू करो. Appendix is supplied by T10 segment. T10 also supplies umbilicus, and therefore pain of appendix is firstly felt at umbilicus. तो पेशेंट आपके पास आएगा, इधर दुख रहा है, इधर दुख रहा है. आप अपेंडिक्स के बारे में सोचोगे ही नहीं, बट अपेंडिक्स एंड दिस हैज द सेम nerve supply, T10, and therefore the pain slowly shifts from here. But you should be knowing the reason, because appendix is supplied by T10 and umbilicus is also supplied by T10. So it's a referred pain. Okay. Then the pain shifts to the McBurney's point, which you will study in the surgery. It lies, between the umbilicus and the anterior superior legs. Thank you.